He's the Executive Vice President of Clinical Services and also the Chief Nursing Executive for Niagara Health. Derek McNally joins us now. Derek, welcome.
Good morning. How are you, Mike?
I'm very well. It's a beautiful day today and some changes in Niagara Health this week and heading into next week, it sounds like as well. First off, let's deal with this week. A third testing assessment center for COVID. How is that going?
Mike, it's going very well. As you know, we opened on Monday, and right now it's at our Welland Hospital site. On Monday, we saw 51 patients came through the centre for screening and testing. We're open 3 days a week, Monday, Wednesday, Friday, and so we'll just see how it goes. But no complaints on Monday. Ran very smoothly. People got there as they should have gotten there. People called ahead for appointments, which is very helpful because otherwise they can wait anything from 30 to 60 minutes if they don't have an appointment, if they're what we would consider walk-in. So yeah, Mike, no complaints and went very well.
More exciting news coming next week, and it deals with visitors to the hospital sites. Mm-hmm. And, I'm hearing a rumor that starting next week, there is a new visitor policy. Can we go over that?
Yeah, let me confirm the rumor is true.
Excellent.
So starting on Monday, June 29th, so this coming Monday, Mike, we will be opening our doors to visitors, and we're just so excited to do that because it's been, and we've talked about this before, it's just been an awful time for family members who are out there and can't get in. So like everything, we're starting a slow ramp up of visitors coming in. So there'll be 2 designated time slots at all of our sites. The first time slot will be from 11:30 in the morning till 1 in the afternoon. And the second time slot will be from 5 o'clock in the evening till 6:30. So 2 time slots, an hour and a half, 1 visitor per patient. It doesn't have to be the same visitor coming both hours, so people can kind of switch out, if you will. Families will have to screen before they come in. Now, we have screeners at the door to do that, but we're just in the final stages of developing an online screening tool that actually families will be able to go online, answer the screening tool, download it, and bring it with them. And they'll also have access to the Niagara Health Navigator app to be able to do their screening online as well. So all of those details, Mike, will be going out as part of our media release and will be all part of the website, Niagara Health's website. When you go there, you're going to see in the next day or so, when the website comes up, it's going to be like visitors. And so there'll be a big banner there and people can go in there and get all of the information. Of course, the place looks different. All our hospitals look different than they did back in March. So people will see that difference. It's critical that they help us manage our infection prevention and control practices, Mike, that, there'll be physical distancing. We're asking that they must come with a mask, and so they'll have to wear a mask when they're in the hospitals. Hand hygiene, all of those things. They'll see that our cafeterias look completely different. There's a lot less tables and chairs there. There's physical distancing. And I think we've done at all of our sites, Mike, a great job with our visual management. So posters and dots on the floor telling people where they can go, etc. So it's going to look very different, but we're just very happy to welcome people back.
Must be a huge relief for families to finally get into the hospital and see those loved ones that they need to see. What about volunteers? Have they been welcomed back? I know at the St. Catharines Hospital, when you walk in the main entrance, the first place that you are invited to stop at is that volunteer booth, the information booth. Will we be seeing them back in the hospital soon?
So, Mike, we're looking at that as part of our recovery planning. So I can say right now, they're not confirmed to come back, but stay tuned. We're hoping that that's going to happen fairly soon.
That sounds great. The visiting policies, how does that work when rooms are shared with patients? I know you do have some rooms with more than one patient in them. Will there be any restrictions as to, can only one of those patients be visited at that single time?
No, Mike, as long as we follow our infection prevention and control practices and visitors are masked, all of the distancing between our beds, even in our older sites, were good, and it would be hard for us to be able to say, Derek and Mike are in that room, and so Mike's getting a visitor and Derek's not. So we did all of that work, and we pulled all of that together, so we're good. As long as we follow our IPAC practices, then we're good, Mike.
Well, two great pieces of news today. Obviously, the Welland Assessment Center is open, and people who are living in Welland should know that. And again, outside of Welland, to perhaps go to that assessment center, which might be for the next few days a little less busy than the ones in St. Catharines and Niagara Falls. And visitors back in the hospital on Monday. Great news. Thanks for bringing that to us today, Derek.
Of course, Mike. And just one last thing, if I may. Our assessment centres will be closed on Canada Day. So I think that'll be important for the viewers. We'll get it out in a media release as well. But I just thought that I'd put that plug in just to make sure people understand that on Canada Day, we will close the assessment centres.
Thanks for that information. Thanks for your time.